Dyslexia na learning disability. It dey affect reading, writing, comprehension of wetin pikin read or write. See, true, still fit affect knowledge of place where you dey go, right and left. Yes. So papa and mama, if una get pikin wey get dyslexia, no need for 12 una to dey quarrel, dey fight, say e no dey my family, e no dey my family, e dey una family. Maybe una no know who get am. And if e be say na one of una, but una don feel manager. So when I forget fight, when I focus on the pikin. Because now it's hard for them to hold information. So you need to use different approach to teach them. Pikin wey get special condition, multi-sensory approach. What that one mean? That one means say you go use all the senses to teach am. You go show am picture, you go hold him hand, take touch am. You go talk am loud, you go show am video. You go put earphone for his ear, make him hear what you dey talk. You go use all the senses related to learn. Make it learn. You go carry am go outside, make it go see what you dey teach am for inside. By the time you change you change environment, you expose pikin to different angles of learning the same thing. One go stay for your head. Dyslexia na learning disability. It dey affect reading, writing, comprehension of wetin pikin read or write. See, true, still fit affect knowledge of place where you dey go, right and left. Yes. So papa and mama, if una get pikin wey get dyslexia, no need for 12 una to dey quarrel, dey fight, say e no dey my family, e no dey my family, e dey una family. Maybe una no know who get am. And if e be say na one of una, but una don feel manager. So when I forget fight, when I focus on the pikin. Because now it's hard for them to hold information. So you need to use different approach to teach them. Pikin wey get special condition, multi-sensory approach. What that one mean? That one means say you go use all the senses to teach am. You go show am picture, you go hold him hand, take touch am. You go talk am loud, you go show am video. You go put earphone for his ear, make him hear what you dey talk. You go use all the senses related to learn. Make it learn. You go carry am go outside, make it go see what you dey teach am for inside. By the time you change you change environment, you expose pikin to different angles of learning the same thing. One go stay for your head. Dr. Danar came down with malaria. Now, dyslexia na learning disability. It dey affect reading, writing, comprehension of wetin pikin read or write. See, true, still fit affect knowledge of place where you dey go, right and left. Yes. So papa and mama, if una get pikin wey get dyslexia, no need for 12 una to dey quarrel, dey fight, say e no dey my family, e no dey my family, e dey una family. Maybe una no know who get am. And if e be say na one of una, but una don feel manager. So when I forget fight, when I focus on the pikin. Because now it's hard for them to hold information. So you need to use different approach to teach them. Pikin wey get special condition, multi-sensory approach. What that one mean? That one means say you go use all the senses to teach am. You go show am picture, you go hold him hand, take touch am. You go talk am loud, you go show am video. You go put earphone for his ear, make him hear what you dey talk. You go use all the senses related to learn. Make it learn. You go carry am go outside, make it go see what you dey teach am for inside. By the time you change you change environment, you expose pikin to different angles of learning the same thing. One go stay for your head. Dyslexia na learning disability. It dey affect reading, writing, comprehension of wetin pikin read or write. See, true, still fit affect knowledge of place where you dey go, right and left. Yes. So papa and mama, if una get pikin wey get dyslexia, no need for 12 una to dey quarrel, dey fight, say e no dey my family, e no dey my family, e dey una family. Maybe una no know who get am. And if e be say na one of una, but una don't feel manager. So when I forget fight, when I focus on the pikin. Because now it's hard for them to hold information. So you need to use different approach to teach them. Key way get special condition, multi-sensory approach. What that one mean? That one means say you go use all the senses to teach her. You go show am picture, you go hold him hand, take touch am. You go talk am loud, you go show am video. You go put earphone for his ear, make him hear what you dey talk. You go use all the senses related to learn, make it learn. You go carry am go outside, make it go see what you dey teach am for inside. By the time you change you change environment, you expose pikin to different angles of learning the same thing. One go stay for your head. Dyslexia na learning disability. It dey affect reading, writing, comprehension of wetin pikin read or write. See, true still fit affect knowledge of place where you dey go, right and left. Yes. So papa and mama, if una get pikin wey get dyslexia, no need for 12 una to dey quarrel, dey fight, say e no dey my family, e no dey my family. E dey una family, maybe una no know who get am. And if e be say na one of una, but una don feel manager. So when I forget fight, when I focus on the pikin. Because now it's hard for them to hold information. So you need to use different approach to teach them. Key way get special condition, multi-sensory approach. What that one mean? That one means say you go use all the senses to teach her. You go show am picture, you go hold him hand, take touch am. You go talk am loud, you go show am video. You go put earphone for his ear, make him hear what you dey talk. You go use all the senses related to learn, make it learn. You go carry am go outside, make it go see what you dey teach am for inside. By the time you change you change environment, you expose pikin to different angles of learning the same thing. One go stay for your head. So dyslexia na learning disability. It dey affect reading, writing, comprehension of wetin pikin read or write. See, true still fit affect knowledge of place where you dey go, right and left. Yes. So papa and mama, if una get pikin wey get dyslexia, no need for 12 una to dey quarrel, dey fight, say e no dey my family, e no dey my family. E dey una family, maybe una no know who get am. And if e be say na one of una, but una don feel manager. So when I forget fight, when I focus on the pikin. Because now it's hard for them to hold information. So you need to use different approach to teach them. Key way get special condition, multi-sensory approach. What that one mean? That one means say you go use all the senses to teach her. You go show am picture, you go hold him hand, take touch am. You go talk am loud, you go show am video. You go put earphone for his ear, make him hear what you dey talk. You go use all the senses related to learn, make it learn. You go carry am go outside, make it go see what you dey teach am for inside. By the time you change you change environment, you expose pikin to different angles of learning the same thing. One go stay for your head.
Hello my people, una good afternoon. Abeg make una no vex, we don take small na because say some of our guests wey plan to come give us better information today, some of them no fit come, last minute cancellation, but na so life be. Una welcome, una do well for una patience. Today, as many of una don see the flyer, today na very interesting and important topic na we get. And I get Dr. Bako with me for studio now. Dr. Bako, abeg greet our people.
My people, now well done. Well, how everybody did. When I saw this, so they started a little bit late. Maybe we don't add like 5 or 10 minutes. But we'll make sure say at least that wait go water a while. At least we'll get to understand what thing we get to talk about. And everything by God's grace will go smoothly. Now well done.
Dr. Kumtap in the come forward. Our brother Dr. Danar Inofi come today. And Mr. Sam too Inofi come today. So by God's grace, they will join us next week. And so last week, now malaria, now we talk about this malaria where everybody they overlook like say na cough, cold, but it passed that one. So Dr. Bako, quickly, just give us summary of what we talk last week.
Okay, my people. At least since we did together with us last week, I remember very well. So we talk about malaria and how they carry affect even learning and intellectual ability with children when they're born, knew how they carry affect them. And I remember very well, I go a long way to talk about how malaria, if it affects Pikin, how they go a long way in affecting to the level of brain, how oxygen and everything they go to brain. Now we know say this brain majority, now they help when it comes to our activity towards at least understanding things, even as Pikin they grow. Malaria will make blood vessel for inside brain block. I remember one we talk about those, and again, if oxygen at a particular time or glucose no enter part of brain at a particular time, if it cause serious problem for patients and even as the Pikin they grow. And that one will affect because those small deprivation of oxygen and everything, if you make the Pikin no fit learn something well because the brain cells no go develop very well for Pikin we still they grow. And I remember we talk say because you get plenty things where they happen even if person get malaria, sometimes you get the way the body go one fight time, cytokines go they release, inflammation go happen, the brain go start exude fluid, how much the brain go even swell self. I remember to say ordinarily say malaria they see like ordinary, even if you make person go into coma, and that, when it already affect that part of the brain, we say now what it refers to as cerebral malaria. And if that thing no they properly managed, you see say it will go a long way in affecting the Pikin as they grow and the brain because of the this nutrition with the brain they get both oxygen and glucose. And as the Pikin they grow, they get problem developmentally and even learning when they big.
Okay, Dr. Bako, thank you so much. You do well for that summary. So for people who ain't no join us last week, when I don't hear small from Wetin we talk about. In fact, Mona hold this one. Today topic too, now also very, very important topic because this thing we want to talk about, so now very, very common behavior. And it even can come well now, both from adults, from children, young people, for man, for woman, but it's not too good for our body. And the topic today now how alcohol fit affect Pikin for inside mama belle. But the thing be say Pikin no dey carry jump enter inside mama belle. Na relationship between man and woman na they bring that belle, which means say this same alcohol too, if it affect man o, can go affect the Pikin as well. Abi, I like Dr. Bako.
No, you did very correct.
So
Very,
Dr.
very
Bako
correct.
now will first of all help us understand how alcohol fit affect man and woman even before they start to dey talk about say they wan get belle.
Yes, thank you very much. Thank you very much, my people. See, alcohol now one thing where if you dey take am, it dey affect almost every part of your body. Almost every part of your body, alcohol they affect them. Wetin be alcohol? They call them some. They even make the name dey interesting so that it will attract people. Say they say alcoholic beverage. So that's it. If they call it beverage, don't be like Bonvita. So you understand? So they try to make them look like say they appealing, but really the thing get plenty things where the negative effect of alcohol they more than anything wey if you do for where they positive. Nothing positive, majority na negative thing. For starters, say you dey drink alcohol. Even either that before even say man and woman get belle or pregnancy come into play. Alcohol for chemistry they call them ethanol, and it get plenty radicals. If you see the shape of how that thing be, you get radicals where we say anything where you take either drug or anything, the first place where they go into your body now towards your liver. Because if chemicals where they dangerous for the body go into your system, now the liver the first go because one of the activities where the liver they do now to detoxify. If they try make that make they harmful so that the body no go get the negative effect of that thing. But imagine somebody come the alcoholic, automatically the thing don't become habitual and waiting in they do always. So automatically it go put and subject the liver into plenty stress. The liver have to detoxify, they do extra work. Where on a very good day, not supposed to do that extra work. And with that, some liver cells go die because the chemical products where they come out outside the way the liver they try handle the this thing. Some of them they kill the liver cells. And if you start kill the liver cells, because liver get this ability of trying to regenerate, it will come form scar tissue. And if you start form scar tissue, you see say the liver will come start shrink. It's just like the way you wound them, the wound they try heal. Imagine say your liver all through come day like that. So when that scar tissue come plenty, you see say some the function will, because the liver get plenty function. The function when they do, you know, go feed them again. You see say storage of protein, vitamins and everything, you know, go feed them. Processing of certain things, you know, go feed them. You see say Belle will start get plenty water. Person Belle will start big. Eye will start yellow. Leg will start swell up. So like this one will just say high tendency because of alcohol. Person will come down with chronic liver disease. And the commonest one way they get for that reason, alcohol liver disease, then be this liver cirrhosis. Apart this one, we just talk about the effect we get for our system. Other things so if you cause again are even down to our brain. Nutritional problem. You can't get things so because you don't cause you gastritis, some things, chemicals, some food substance, the body don't go feel absorb by mental body. And you can't be malnourished. So you may see some people now chronic alcoholic, you see them, all of them sit down for one place. You see all of them resemble. I know you say like the same amount born there. Because at the same behavior and they subject, you see say their head, they don't look like surprise, all of them.
They look like surprise.
Because one
they
protein,
look like surprise.
plenty protein, they low.
Surprise get face.
They don't surprised like that. That's why their face sweet. So you see the nutrition, and whenever you date too alcoholic, you see automatically your immunity go dey suppressed. When your immunity is suppressed, automatically again you dey subject to any infection wey go come. And again with alcohol, you are subject to plenty wrong behaviors, unprotected sex, use of needles and everything. Before you say anything, HIV don't come inside or any other sexually transmitted infection will come. And another common thing that affect infertility, low sperm count.
For man.
Okay. For man, men will come down with that. Okay. For women, again, that addiction is very too high. We be say, man, if you know if we control ourselves, just the way it happened to men, now the same thing will happen to women. So alcohol, they touch everywhere from your brain to your skin, to your hair. And I mean, if you see person chronic alcohol, you'll see doing hair, they become no protein. Nutrition don't they affect it. You see the hair just they coil, and they eat. You know, they dark the way normal person hair go.
Dark.
So you understand? So malnutrition is one of those common things. So alcohol, they affect almost everywhere, even before Papa and Mama marry self. So if it affect every system for the person body.
Just a person not go to do alcohol test before you marry now.
It is very important too.
We add that one, join the
because
test.
majority of people where they get infertility problems.
Now alcohol, don't drink all.
Also
take
part
alcohol,
of
spoil them before they
part,
come marry.
Exactly, alcohol is a part of it.
My people, I think that they hear now. This is totally the hair where the person head alcohol go fry am.
You go fry am.
You go change the color.
Yes.
So nothing good for alcohol. This one where they go to talk now say people where they sell wine, they go say small sip go help your heart. I beg, doctor, you there here now. Small sip of wine they help heart.
See, alcohol don't get any positivity. That especially that wine on they talk about now. One particular chemical will make that wine especially get that reddish color. Especially that red wine, not any kind of wine. You get one particular chemical where they that red wine. Maybe the alcohol in itself. So Mokwi, they always try to find balance and get information very well. It's not the alcohol in itself that makes you at least make a better heart. Now that particular component will make that wine red.
But if you don't put that alcohol will be chemical now. Can't join the red component where they the grape. I mean not be grape there. Where they the grape. Where supposed to help your heart. The alcohol never spoil the chemical for inside the grape.
Suppose don't spoil them because you see sometimes addiction when you come follow instead of trying to take the one way go they okay for your system.
So kuku buy the grape when you chop them now.
Just chop grape.
My people, me I dey enjoy myself. I hope so that they learn and they enjoy themselves. Okay, Mr. Bako, this Mr.
No, all now that's the same.
No, it not be the same. Dr. Bako, different from Mr. Bako. Okay, Dr. Bako. we go continue with this our talk now. So now you don't talk about generally how alcohol not be wetin person fit take do pastime
at all.
Now which you supposed to make effort not to even near at all because it not get value. At the end of the day, the destruction where you go cause, it pass any gain where you go gain for it. And that destruction go start even as that young level where you don't drink until when you want to already build your own family.
Yes.
You go come be say
you know if we get
Pikin. Whether now you be man or whether now you be woman. Okay, now we don't talk about people before they marry. What about women now we come be say they don't come get the belly now?
think.
And they go still come dey drink the alcohol
So
with the pikin
that one
for
is
inside belly. So now, not be only them now, but the alcohol go dey get impact on. It go dey get impact on the pikin. Okay, as a neurologist now, how this behavior go take affect this pikin wey dey inside this woman belly?
Ah, thank you very much. I think if there's any other thing where person supposed carry go house for this our discussion today, now be say how alcohol then when affect pikin. The pikin is no concern am. Now you want drink your alcohol, you forgot drink your alcohol since they don't tell you, you no choose to stop. No come affect person wey even dey inside belly. The fact is, just like I said, alcohol is one of those chemicals where if you take, because you know pregnancy, the only way where the pikin they carry get food now from the mama, from the placenta. And the way God don't make that placenta be say they always try sieve some strong substance where you no go fit cross enter the pikin side of the whole belly. But alcohol now one of those substances where they fit cross the placenta barrier to the other side of the child.
Go cross am.
It go cross them because it's highly volatile.
Okay.
Yes. So it crosses the placenta barrier. So immediately enter, your sister go concentrate for the amniotic fluid. That's that water way pikin.
They stay and there, yeah.
I know say
the safe space for pikin.
thank you. And pikin, it always gulp that very water. Even in one pussy because those meconium all inside that water, and the pikin they swallow. And during the stage of pregnancy or when mama they pregnant, pikin every part of him body they develop. From the skin down to the brain, to the heart and everything. Within those periods at that time they develop. What alcohol will do be say if mama they take alcohol when she they pregnant, it means it will affect the developmental processes of that pikin. Either within especially the first 3 months or even towards the last. Alcohol we call an teratogen for pikin. That's anything if it cause abnormality, possibly even cancer for pikin. Is a teratogen. So now something where if you no ever even do if you get pregnant. So what you
now the year no ever do one.
Ever do one if you get pregnant, no take alcohol. So if you enter this fluid, amniotic fluid, begin with the sip and again where the effect the day more strong depend on the type of alcohol where the person they take, the duration where the person they take the alcohol. Now go tell how that thing will affect that pikin. When it begin they see brain development go they affected, and if brain development they very much affected. You see so automatically even when they give birth to that pikin, the pikin will come one kind. Because it will affect the brain development, nerve development, and the likes, even the development of the heart. Because one, anything they call teratogen, if it cause break in normal development of the pikin. So you see most of them come down with heart problem, come down with brain problem, all those autism, attention deficit, hyperactive disorder, all of them they come down with them. On mama way they take alcohol when she is pregnant. Because now type of them where they say all those toxins. It's part of the toxin when we talk about those autism, ADHD,
inflammation,
all now they be the toxin. In the part of the toxin where they cause most of those problems. Brain development is affected, and when brain development is affected, they come one pikin. Pikin when you come out see this pikin. One of the commonest is they get one particular kind of look. Yes, the children we
for fetal alcohol
syndrome. Yes, when they don't born them. They call it fetal alcohol spectrum disorder.
Oh, na spectrum.
The thing I just do when we talk about autism spectrum, that's to tell you say you get plenty thing we follow body come, according to Dr. Mr. Sam. Plenty thing carry body follow come. Fetal alcohol spectrum disorder. They'll first get one funny look first. If you see their face, you see say this filtrum, this line where they between everybody mouth, their own go just they blunt. You know go see this line where separates. Okay. Yes. You'll see all of these, their eye opening, were they very smaller like Chinese, were they closer towards the end. You need it even they much more pronounced for them. Then you consider and get thin upper lips, thin one. You know, small thin upper lips, like say one problem, so they will get that one. So these are the physical outlook first they will first get. So then you just say then they one kind for starters. Number two, apart from the other heart problem with them figures, holes for heart and the rest, maybe some of those tissue not get joined together. Another thing they can't get now, developmental disability. development will become so problematic. You see, to achieve milestone become difficult. Let's say Pikin supposed to work out for 1 year, they are on the field reach 2 or 3 years before they start working. To even talk, Pikin, if you say ba, ma, within a short period of time for them, it could take them longer time. Crawling, Pikin supposed to crawl, let's say 4 months, you also say their own go day longer. So these are part of the spectrum, then the behavioral and cognitive problem. Learning disability don't come into play. You understand? Although they are prone to autism, they are prone to ADHD, all of those children. And they're even prone to seizure abnormalities. Because one, during that time where the mama they take those alcohol, those toxins, they don't go fit cause plenty problem inside the brain. And abnormal circuitry and connections we supposed to have, normal we supposed to have for brain, abnormal if you don't set in. And those areas after delivery, if be the area of abnormal electrical activity inside the patient brain, and subsequently the Pikin will start get seizure disorder. So these are some of the problems where they face here. So this one now the spectrum of fetal alcohol spectrum disorder. So it carries from the physical outlook of the patient, behavioral components, cognition, learning, and even other comorbidities like the heart problem and other things that you come with. So this was that big spectrum. Wow. A very, very big one. So imagine just because you want to take for your own good, then a full human being you never born, you want condemn in life. So this is most of the things that usually happen for people who where they take alcohol when they're pregnant. So with all of this barrage of things, so the basic advice, how much, how many minutes you want to take this thing. For generally, when we talk about even the alcohol, so plenty of people in psychiatry, if you go psychiatry, this is like almost 20 to 30% of them are alcohol.
Really?
Yes. Maybe weed or drugs. Many of them are alcohol. We make them mad. Because when you get withdrawal syndrome, before you sit that, the system will just knock. You start talking here, you don't feel sleep, start get convulsion, withdrawal syndrome don't set in. Before I talk, you say you try to come out something for your skin because they feel abnormally. Plenty testimonies like that. So if you go, you see them plenty. So alcohol, especially for children, is not something where you're supposed to carry close to begin, especially when you're pregnant. When the Pikin still develop, you are trying to say you are preventing the development of that child. It's like you're just your own beginning born, let's say they count cost on them. So prevention is to just stop it. Not even take them from the first place if you're pregnant. If you stop, not be anything to take safe. Not just the summary of it. So fetal alcohol spectrum disorder is if you say you want to go read that in everything too plenty.
Really?
Yes. This alcohol and Pikin have. You see the physical outlook, the cognitive problem, the comorbidities, the developmental problem. Everything was plenty. So prevention is always better than cure.
Dr. Bako, wow, you carry us.
Madam, if you talking.
I tire because at the end of the day, when the Pikin don't come like this, families go complain, mama go complain, everybody go talk, but now that Pikin ain't go suffer pass.
Yes.
Imagine Pikin when they get, seizure within short spaces of time. You know what it mean for the body? So they go into seizure.
Yes.
Just they go in and out of seizure, in and out of seizure, in and out of seizure. No matter the amount of money where you get, go fee take pay for the pain and the stress with that Pikin they go through.
They're affecting development psychologically, physically,
so
everything.
What is the point?
Seriously.
In the first place? Where you say you go get Belle, you go carry alcohol, you go to drink. Just because you go party, you say no, or you get stressed out. Food not hungry, in alcohol, they hungry.
Since they call them beverage, just go find food or drink coke.
When I not take and do beverage, make una not take and do beverage, because at me all. When they hear all this one, I tire because I just try to understand. Say, if that Pikin fit talk to that mama, I know the word where go talk, it go full book, it go remain. Seriously. Because what did the Pikin do? Where you just render them useless like this. Because at the end of the day, no matter how much effort they put, the Pikin go the struggle. Seriously. So much struggle. And at the end of the day, if we even with this behavior cut the Pikin lifespan opportunity, yes. very short.
Yes.
So the short time when the pikin go take day life, he go just dey go through all sorts of sorts.
Yeah.
Because him mama no fit control himself.
Exactly.
My people, if una get question, una start to dey submit them. If una get comment, una leave them as well. So this our program, so Ability Inside Disability, from Beautiful House Foundation. Now program where we bring to talk about learning and intellectual disabilities. Wetin these disabilities be, how they come, how we fit to support people wey get am. So question don't come. We will give chance to Dr. Bako make him answer the question.
So thank you very much. Somebody asked, say at what stage of gestation, say most of these alcohol problem fit affect pikin when in the mama belly pass. As a matter of fact, the first trimester, which is the first 3 months of pregnancy, is the most vulnerable moment within development for pikin inside the mama belly. That's in utero, because that's when most of the organ, the body, as the gamete don't they form a particular part of the tissue, they go these ones, they form this within that first 3 months. A particular part, they go this part, these are formed, and like that. And within that period, if person they take any toxin, I may go say if woman they pregnant, safe, even if anything they worry, you not take any medication, first go see your doctor. So that thing go look for medication where we say, you know, would they teratogenic, just like we say alcohol and teratogen. Yes, anything will cause effects for the pikin within your belly. That first 3 months, now him be the one of the most sensitive periods within the development of that child. Be that as it may, I can guarantee you that within that frame of time till when that child they go born, things still dey happen. Maturity of most of those organs, the brain and the likes continue. Why you think that even if you born begin, the begin they talk? No. Why you born begin, the begin they work? No, because development still they continue.
Yes.
So within that time, whenever you take these dangerous chemicals, which alcohol is the one we're talking about, they will go a long way. Within that time, they affect that pikin in development and everything, especially those nerve connections, the brain development, they affect them seriously. So now you say when I come born the pikin will get one. Even at towards the end, towards the end of the pregnancy, that pikin will come down. Because as the one they take it, the pikin they very sluggish, very slow thinking, mentation, they affected seriously. So at the first 3 months, much more dangerous, but for alcohol intoxication and maybe teratogenic behaviors of alcohol, it will happen within the whole lifespan of that pregnancy. And prevention, we said, is very much better.
Is the solution here? Now prevention will not be say better than cure now. Now be the only cure. We're there for this matter.
Because if you check and say, you know,
stay away from it.
Stay away, not to stop her.
Stay away from it. Another listener send a message. He say, I the on your phone. What not be person? Okay. He say, good day to the CEO and the only doctor in the house today. So far, another doctor saying they come, we they wait. Thank you very much for the good work you're doing. Thank you so much for participating, because if we not get who they listen to us, we not go feel say we they come here and talk. So now do well. So now they come join us, now they listen and they learn. Thank you very much for the good work you're doing. May God Almighty reward you immensely, and all of una too. Doctor, you are more than 10 doctors in the house as they accepted today's topic. Well done. May God increase your knowledge.
Amen.
And you too. Thank you so much.
Thank you
So,
very much.
my people, as I talk just now, the goal for this our program now for us to talk about this learning and intellectual disability conditions, to educate each other on wetin dey cause am, wetin we fit do when it don't happen. Now we talk about alcohol. At least we know the one wey alcohol dey cause. The name now, fetal alcohol spectrum disorder. You see the name now, they add alcohol join am because this one na specifically alcohol initiated condition wey dey affect learning, development, and anything wey relate to pikin growth and the entire life span circle.
Yes,
right?
yes.
So the other conditions we go still talk about them as we dey go for this program, because why I dey talk like this be say some people go say, this program na for learning and intellectual disability, why we dey talk alcohol? Yes, we dey talk alcohol because we want make we fit stay away from things wey go even make the disability affect our pikin in the first place as much as possible, because once dem don come, no be joke o, whether na money o, whether na time o, whether na effort o, e no easy at all to manage, especially developmental disability condition. I no say learning easy, but at least learning na mostly restricted to say pikin no, e read, e no understand, e no sabi write well well. But when we say developmental condition, that one plenty o, plenty well well, up to the motor skills, e no fit waka, seizure, all of it, so e too plenty for inside one human being. And na stress, yes. I dey always dey talk and say there be gifts wrapped in tests, but this one wey you go drink alcohol, this one no be gift wey wrap in test o. This one na you take your hand find this kind test.
Na you find that problem.
This one na you find am by yourself. So this one wey we fit stay away from, wey we no go find by ourselves, take money buy wetin go put us for trouble for the rest of our lives, make we waka comot leave am, make we find other things wey we go take replace alcohol, take entertain ourselves. No be wetin you go suffer for life, hold you back, now you go dey invest in. So now before our other doctor come, the other question now, that question na for me, okay, because as e be so, we don talk all this one wey we talk so, but we go still get people wey go still go drink the alcohol, because maybe for their family their blood different. They go drink get purifier. They go drink that true that. Because after all of this one we don't talk so, you must get purifier for inside your body. We go make the alcohol not pass. Go meet your pikin. That one go be the only explanation when you go feel whole talk. So if you as you can't decide say your blood get purifier, then you can't really drink alcohol and the pikin don't come. It don't come, you don't go through where. You don't go through where. So how we go to manage this pikin now? Now that one, now me go talk put. First of all, you when you born this pikin, and you know say this now wetin happen before you born this pikin. Now you go sit down well. You go accept. First of all, accept. Say okay, this pikin don't come. I need to do my best to help this pikin. First thing first, they don't diagnose them already. Abi?
Yes.
They go tell you everything where they affect the pikin. As Dr. Bako talked just now, na spectrum, which means in addition to possibility of say pikin go get many conditions, different issues, it still means the level where the alcohol go fit affect the pikin, if it different. Because maybe you don't start to drink and you can't remember, say, you watch this program, they say you no good, you can't quick stop. Yes, if it don't spoil something, but maybe it not spoil something, reach level where be say the pikin no go fit do anything with your life. Okay? Another level go fit be say you don't drink and don't go far small, but you still stop. Then for those where you not just stop at all, if you be say at the end of the day, your pikin go get very, very profound form of this condition. And the profound form of this condition be say, now patience, now you go get till maybe the pikin, God call am make e go rest, because profound conditions for developmental disabilities, most times these children they no dey fit do anything. They fit just be pikin wey be say 24 hours they dey on top of their back, or they dey inside wheelchair. Yes, everything while they talk so they put fear, and that is the aim, to put fear for our mind, because now wetin una go see real na be this. So make the fear enter on our mind now, so that una go fit stay away from wetin fit cause am. Because the thing be say, if you not get any role for developmental condition of your pikin, you go feel pain, you go feel sadness, but you no go feel guilt. And because you no go feel guilt, space go still dey for you to heal, and chance go dey for you to fit support your pikin, because you no go hold yourself responsible. And even if you hold yourself responsible, with therapy and support, you go overcome that stage because na normal stage of grieving when you did this kind of situation. But when it be say na the alcohol wey you drink na it produce pikin wey dey at very profound level, e no fit do anything with himself, come become massive burden for you. Me, I no know how you go fit dey live with yourself because the level wey me I dey with my own, I know say no be joke, no be joke at all, and it's not even no, e no even dey profound level. Thank God. So, but as I dey talk, dey come. Anyhow, the pikin don come. So, hospital go provide medication, abi?
Yep.
For the areas where the pikin go need medication for. Then therapists get their role. Because as Dr. Bako talk, they talk about conditions like attention deficit and hyperactivity disorder. They talk about conditions like learning disability. Learning disability we mean say it is hard for the pikin to read. It is hard for the pikin to understand what they read. If you have for the pikin to even if you hold a pen, right, because that alcohol don't affect motor skills. So all of these pikin go need therapists to feel help am gradually build as much as he feel build so that into go fit still contribute, participate for your own life as he fit. So, but all of these things, they're not cheap. They're not cheap, but now waiting persons with this situation, now waiting they need be that. And the home where this one for happen, una go accept them on. Una go accept them because I know say it go hard though. This one go hard though because I don't understand how mama go fit live with her guilt to the extent say go fit care for this kind of consequence. But these na the resources where this kind of pikin go need to fit, especially those where they mild, moderate, and even severe. And you must start early. You must start early. As they give the medical side, as they give you medication, use your medication well for the pikin. The therapy side, let the therapist do their work. And you too will be the parent, put eye for ground to understand how they help your pikin, especially the therapist. Because therapists go come your house, you go spend 1 hour, maximum you spend 2 hours with your pikin. When it come out, now you go follow through at the end of the day. So the ones where if you go school for inside, muna not hide you in a condition from school authority. Let them know what they happen to the pikin. And if possible, let them do meeting. Let the teacher of the pikin do meeting with the therapist. Because the therapist go dey in a better position to explain to the teacher what they do. I even sometimes guide the teacher on the approach where he go take to help the pikin so that all of them go dey use almost the same method, if not the same method, so that the pikin no go dey confused, and even the people wey dey support am no go dey confused. We get other questions, abi?
Yeah,
this one na textbook.
No, the sweet thing, the thing where you dey answer now, you dey answer the first question already.
Really? Wetin be the first question?
The first question be say, Doctor, I recently met a young woman who admitted to drinking alcohol heavily during the early months of her pregnancy, not fully understand the risks involved. Now her baby has been diagnosed with signs consistent with fetal alcohol spectrum disorder, such as delayed development and facial abnormalities. She is devastated and wonders if there is any medical or therapeutic intervention that can help improve her child's condition. From a medical standpoint, is there any way to reverse or manage the effect of alcohol exposure on the developing fetus? Then in number 2 question, so that we'll just talk all together. Please, is it possible for a couple to do alcohol test before pregnancy to avoid all these problems? So men drink secretly. That's what he's doing. So let me make it because this Modupe have almost answered to the first question. Because say the alcohol, fetal alcohol spectrum disorder, they come with different, that's what they call on spectrum. The presentation is different. Some of them they come ADHD, they come with autism, some they come with seizure disorder, some even they come with cardiac problem. So it depends on waiting the begin carry come for body. Now so they go carry manager. But then from a parent standpoint, and the mistake really happen because most of them is usually difficult to reverse. because when an injury already to the brain. So more of management will help, and especially when they begin they grow during that time, if they feel know where things the problem, how to support that begin as they grow. You say behaviorally the begin go start adapt to certain things, and somehow it go help them at least attaining milestone before he reach one particular age. So mostly that depending on how the patient present himself, quite okay. Most times it's usually difficult to reverse because the injury had already been done. But the primary thing be say, make we just know identify the problem, and just as Ms. Modupe talk, you go just follow up with at least handling the problem as they see them and support the child, even from home, school, and everything to the level of the teachers. Medodo John will say, and this one a Pikin way at least need extra attention as compared to, but still depend on waiting be that spectrum where the Pikin come down with. So as you guys say, whether if you run tests for person where they take alcohol, yes, they will run tests.
Yes, so man, do
they will run tests. Here too they call toxicology.
Okay.
They will get them from
now.
But the primary thing, interaction, we should just learn to be truthful to each other.
Yes.
Because if you try marry person, for God's sake, why you go and say you become like you go to hide something, you be stranger to the person. Then if you go to, and funny thing, alcohol go embarrass you. No matter take alcohol, it is difficult to hide the smell. It is difficult if you like chew this one, chew that one. Unless person don't keep close to you, you go hear we call them fumes. You must hear the smell.
The smell, the smell will give you
because
away.
The thing from because as you breathe, it come from the lungs out.
The lungs out.
In as much as the liver is still they detoxify because say they dangerous, you go try control and say, man, which person be this? Why they take this kind of thing? One cause me problem. The liver go the control, and meanwhile from the lungs as you are breathing out, you see the person they perceive them because one it also excrete them through our respiration. So primarily it's from doing your marital counseling, doing your courtship. You are supposed to be truthful to each other. But if somebody you suspect the person is doing because you go perceive them. You go perceive this bad, and again, out toxicology. But because say maybe something they stay for body too long, so sometimes the person if you take them today before you say 24 for day, like even if you text, you don't go see anything. Unlike other drugs where if you pick, even a marijuana, even within 1 week, even if the person no smoke again, if you still pick them for the system. But alcohol, you go escape after a short while. So not only when maybe the person take, then you feel test them for that time.
My people, I hope say Mr. Dr. Bako answer. He answered the question as una one time. Make I add to Wetin Dr. Bako talk just now for the first question. Now they talk the come just now. Yes. When the Pikin don't come finish. So most times, at least based on our knowledge of this condition, if not learning disability, which means the Pikin go dey delayed. You go in milestones first of all go tell you say this Pikin they grow as it made supposed to they grow. Okay, so if you get difficulty to relate with in peers, small children they know they wait make you say play with this person. Once they see another small Pikin like that, they go run for long. But children they get social relationship issues. I mean children you go sit there, all of them will go stay corner. 20 children go they play around them, but they no go join them. So the first thing I go to do, especially those women who see them drink alcohol, when they don't born, we can observe on a Pikin. We can observe them so that I go to know the thing where they come out. They now they know time. Now all those ones, then I go fit tell doctor for assessment time. We go fit guide on. So if the social skills not there, the language they delayed, the time we're supposed to talk, they talk, or maybe they talk just they use few words. Then if they get aggressive outburst for no reason. Go just shout, they scream, they fight, they do all. In my experience, at the end of it, that's after assessment. I'm not prescribing anything now, but that make me use in my experience. Definitely, go need applied behavior analysis practitioner. That is ABA, because their job now to reverse behavior where go hinder the growth of Pikin or person to positive behavior. Now go need that one. For the speech, if you need speech therapists, then even for for the academics, now go discuss with teacher for school. Then for the hyperactivity and attention deficit issues where if you get ABA too, go work for that one. Because what ABA they do be say they manage everything behavior. And what be behavior? Behavior now anything where would they do? As I talk, so now behavior now they engaging. As soon as they listen, now behavior now they engage in. But the thing is, I sit down for here now calmly. They talk when I talk. I know hold Dr. Bako shirt as I they talk. I know hold the trouser because that is not be the appropriate way of behaving. So what the ABA go do be say all of those behaviors we know they appropriate. We know where it go stand between the Pikin growth and attaining independence to be to take care of himself, do things we're supposed to do, maybe a little bit delayed, maybe not if we do them exactly as he made if do them, but you go first help himself. This therapy go help the Pikin if he achieve that. But the first thing when that mama go do, not to go hospital. When you go hospital, they go do assessment. But before you go to hospital, carry paper and pen. Maybe you write every observation where you see for your Pikin body. Very important, because no matter what everybody they do for us, for our Pikin for outside, now we be the first contacts we then get.
Yes.
Now we did the most responsible for them as parents, and that is why now we must pay attention. How they eat, what he eat, how they react to the food. He eat finish before he eat. What he do? Okay, they shout. Why they shout? All of those things. Note them down. Note them down. Then all of those ones now you go to ask doctor one by one by one. If doctor need attention of other therapists, he go call them. All of them go sit down, do full assessment for your Pikin. So from that assessment now, the diagnosis where they can't give you now on your own too. Today, I know say everything with the internet, correct, but it still feel they helpful.
Yep.
Because now the behavior where my own boy they display, where I not understand why they play. I buy toys for him. He just line the toys up for straight line. He lie down. They look the toy. Who they play with toy like that? I never see Pikin play with toy like that before. My entire life. I enter internet type Pikin where they play with toy straight line. What it be this? The response where I see now possibly autism. So as a parent, we have to be proactive. And when I go hospital, they confirm wetin I see. It's possible say I'll go office, they go hospital, they go say no, not be wetin you think, but at least they make effort.
At least.
The one way you don't understand, say doctor, see, I see this one, no, I hear this one, no, not true. And doctor fit tell yourself, say calm down, not run around. But it's still better to say you just sit down. Better pass say you just sit down, they do anything. No. So observe that young lady so. Not fear. Yes, I put fear for Belle because everybody need this fear to stay away from alcohol. I not get regret for that one at all. But now it don't happen. Observe your Pikin. Note everything where you see, where you know, say, they're regular in terms of growth of Pikin. Then go hospital quick, because from age 0 to 5 is the best age for intervention. Yeah. Early intervention. Anything we want to do to support our children, age 0 to 5. Is the best. Why? Yes, the brain get injury. This one get injury, but they grow and they are young. There's opportunity for all of these organs to regrow themselves and improve, pass as the Pikin for be if we not do anything. Exactly. So my people, we get only 6 minutes more now. Another question don't come.
One last one.
Una do it today. Una participate well.
The question say for a woman who drank before realizing she was pregnant, what immediate steps should she take upon finding out?
Stop.
That's the first thing. Stop. Because if you remember when I been talk about it, I told say the tendency towards coming down with this fetal alcohol spectrum disorder. Now I be say the duration and the type of alcohol where you take.
Yes.
So automatically the duration where you take the alcohol now one determining factor to see that if you affect the Pikin or not. So they said the first time to do something like 10 years ago, the next best time at that time when you realize them. So if you know say this difficult, if you don't realize say no stop them that time. If you be say the ones where you been taking never reach level where it will cause problem for the Pikin. So at that time just try stop them instantly and try to say you continue with your follow-up visit with your gynecologist. Make sure say they at least they always screen you, scan the Pikin, because activities most of them when they take that alcohol, you say their ability to kick and everything, because the children don't they slow. because the brain development they retarded. So the ability to kick, all those kick way mama they get when Belle, when she they pregnant, their own they very reduced. So most times you say the doctor go the manager will tell say anytime say if he give you fetal kick chart, you say the begin kick tick or right a particular time or the date.
Because you know they hear and when.
Yeah, so that when they study how the action of the Pikin be, especially for the one where you been they take before you can't stop. So they will feel monitor that Pikin. And maybe they feed at least augment with some vitamins and so that those folic acid they take, maybe they think of adding other things. Primarily because that folic acid, if you remember, now one of those things where they make sure say the spinal cord they connected properly. Because folic acid now for
now folic acid
now for the nerves, especially development of the spinal cord.
Really?
Yes, that's why they add folic acid, because if you know do a year they call spinal bifida, you see say the opening, the spinal cord development can't develop reach outside. Maybe say the Pikin from down leg down, your bone Pikin they paralyzed. Yes. So folic acid, as they say on the carry and play, they very
that's small yellow
that
tablets.
tiny yellow guy. Very, very important. So now there you see the other facial iron, because development also because red blood cells and everything to help mama make she get better blood, so that if you pump to the placenta and Pikin will get food through there. Now they give that facial, which is the red one. But folic acid primary to tell you how the brain and spinal cord and nerve they very important. Now why folic acid they part of what they give every mama. So anytime that the time where you just think say that no correct, stop on that time.
And as we talk and so like say they important where for women we don't use alcohol, we decide to stop them, make them tell their gynecologist.
So that if there's any way to go supplement, because everly something will fit day where they fit do for them. So that at least to help say maybe Pikin no come down with any of those syndromes.
Okay, my people. Our time don't they tell us say it's time to go. I don't want to go, but I need to go. And I know say una still get plenty things we una want to do today. But una do well when I come today. As una they support us, so I hope say una they gain from us. Because we they gain from una. Because say we they come here today, can't talk to una, we must make sure say we carry better conversation come. We don't want maybe say we just spend 1 hour, we not gain anything. So we they try to they make sure say what we bring come. Now what go benefit to now and it go benefit us. So I beg, una friends, una family members, we know about us yet, we join us today, make una share these links with them, so that they will benefit. Still last week now, malaria. Me I tire as malaria affect cause learning disability.
Yes.
You know, another doctor they tell me today say if she get case, we be saying a teenager, the Pikin lose everything. Enough he talk, enough he waka. From cerebral malaria.
Yes.
So all of these things, where would they take lightly? If it be, cause of huge problem for another person's life, where would they responsible? And even our own life tomorrow. So I beg my people, make we take what they talk for here, make we take them seriously. So that the things where we feel prevent, make we prevent them. Because learning and intellectual disabilities, not be joke for anybody. But the person will get them. And the person will they take care of those people will get them. Easy. Where we feel remove things, we be say it will stop some things, make we do them. Because not everything we must enjoy. Una do well once again, so now join us. So when I not forget to share all of these links. So until next week Saturday, my name na Modupe Afiz Ogun, CEO founder Beautiful Hands Foundation, and this na
Dr. Bako is the founder of Bintum, neurologist and secretary NMA Plateau State Chapter. Well done. See you guys next Saturday.
Bye bye.
Thank you.